everybody. As I told you, I said that I will ask all your questions to Dr. Bugorsky. So here is Evgen Bugorsky. At the last day, I'm taking just interview with him and asking all the questions you asked me by Facebook, by messengers, Instagram, everything. So the first question, it will be about.
Excuse me, I'm neurologist.
Yeah.
I'm a neurologist and I'm working in this technology, Translingual neurostimulation, more than 10 years. 10 years old, and we were the first company in the world, in the Russia, who starting working with this device with parents, with patients and in children. Cerebral palsy, multiple sclerosis, traumatic brain injury. Yes.
Some children with autism as well.
Yeah.
It's not much, but some.
Yeah, because it's autism is very difficult disease because it's not understanding process what is the brain. And for example, when we will be working with cerebral palsy, we can get result after 2 weeks, 2-3 weeks. Maybe a small result, but it will be, we can see visible, yeah. But when we're working with autistic children, it's very difficult, and maybe the first progress symptoms will be only after 3 months. It's it's different time.
Okay, I see. So the first question, of course, all parents ask, what's the difference between PONS device?
Yeah.
Which was studied in the United States, they know PONS device. So I have PONS device for Mark, you saw already on the videos. And why I was searching Reading device. And what's the difference?
Okay. What I said previous time that we started working with PONS device more than 10 years old. And what was problem and not problem, it will be more effective. It's very nice device and very effective with movement disorders, and not only movement and cognitive disorders too. It's help to us improve effective physiotherapy rehabilitation program, because stimulation time we can create new synapses between neurons and improve working of neurons in the brain. And what we'll be using training for example, for walking, balance, thin motoric and speech improvement, it will be more effective, will be improved. And yeah, it's good. But in the process using this device, what's will be not autistic, it will be not comfortable, because for adult it's okay, it will be good fixation on the neck. But for using children, because neck more thin, in their balance, in the process of their working, you can device can fall.
Yes, it can fall down.
Yeah. And for example, some children
they hate something on the neck.
Yeah, not like using something on the neck. For example, autistic children.
Yeah.
It's one of their first symptom for autistic. It's a very they to try save her space.
Yeah.
For example, not touch her neck. It's very difficult. And what in the process using any else limit time for electrode only 3 months. You need to buy new electrode every time, and additional you can reset unit control. What it means? You need to special program reset separate device. You need to send to our clinic or to Helios, but this moment Helios, this version, this device not support. Only a new device. It will be new electrode, new remote unit.
Main unit.
Main unit, yeah.
Main part.
Preview time was you need to buy every 3 months electrode and reset this device.
About Realin?
Rehaline. Rehaline.
I'm
yeah.
sorry.
Why Rehaline? Because rehabilitation line.
Good. Okay.
It's mean here.
Yeah. I just read it like in
French,
Russian.
French.
Like French way.
Yeah,
Russian
French.
way.
Yeah.
I don't know.
And here other form of device. It's more convenient because you can
put on the cloth.
Put on the clothes. Any else? Maybe it will be more easy. Cable of electrode not long. You can use this one, and for operator or kinesiotherapist or physiotherapist, very convenient to check what we built.
What are you doing?
Yeah,
exactly. How much power you
power intensity. Yeah.
Intensity for the child and so on.
And about
also, I noticed one thing because I used also both. I noticed that, for example, on Pons we don't have 20 minutes. We don't know. It just stopped.
Yeah.
And here we can see how many minutes stay. It's counting minutes. How
Correct.
many minutes you have. For example, if Mark's asking me, Mom, how much time it stay after 20 minutes?
Yes.
How much? I know that, for example,
Correct.
3 minutes, 2 minutes, it stay on red.
Correct. Yeah. And electrode you need, you can program it for 1 year, 2 years, but in our version it will be programmed on 1 year using because it's
mouthpiece
mouthpiece,
is for,
yeah.
And the principal unit you don't need to recharge.
No reset.
No reset.
No reset.
Good.
Only if you will be using this device, you can need only buy new electrode after 1 year. Yes.
Or you can just order it before it's finished or beforehand.
What to point, it's form factor, new form factor, and time of using mouthpiece.
Yeah. It's the same. It's the same heavy weight.
It's the same. Yeah.
So the second question the parents were asking, it was about Dr. Danilov, because everybody saw that he was writing all the clinical trial studies and so on and so forth for Crohn's. And so is it possible to talk and to have his own point of view? Some also asked me his personal numbers. This I can't give personal numbers of doctors, it's not possible. I can send you only to Evgeny, and then Evgeny can communicate to Danilov, and Danilov can answer all your questions, even with the video conference, because Danilov, he's supervising like a clinic.
Yeah, supervisor. He is going to our staff, and certainly you can have discuss with him, but it will be very difficult. More easy will be organize conference
like
Zoom
conference
Zoom.
We can organize.
Yes.
Yeah.
For example, will be more than 5 parents or patients.
Patients want to talk with Danilov. It's possible to organize the conference.
He will be glad. He will be glad to help and introduce what is methodic. He very nice and very interesting. Introduce what is it, what history this methodic, what prognosis and perspective this methodic in there other diseases, for example, traumatic brain injury, Parkinson, multiple sclerosis, and cerebral palsy. He will be a very interesting introduce. Yeah.
The third question it was: is it possible to order, for example, TLNS Realin from USA?
Good question, but on this moment we not have registration in the USA. It will be not will be right to send directly to USA. No, you can use this device on the territory Uzbekistan. And when you will come here, you can have training. Why you need some training? Because if you will be get this device, you can think that it will be a magic stick or magic maybe medication,
Yeah.
but it's
not
not correct. It only help to improve process in the brain, but you need using some exercise, movement exercise, balance, only speech improvement, because it help to exercise. And our our target to show you what exercise need for your children, for your kids, for your in the process rehabilitation.
And especially it must be individualized. It's every
Certainly,
child. It's
certainly,
everybody
yes.
is different. So
Yes.
some children needs one exercise, others exercise. So it's exactly for the child. You mean. Of course, some programs can be similar. Like in CP, we have a similar exercises for different children because they have the same problems. But at any case, the program must be done for a child.
Certainly, because for example, when we are starting working with a child with cerebral palsy, it may be different condition. Yeah, one children using wheelchair, other can working yourself. For example, using balance training for one children, you need he can stay a vertical position, and we can using something improve her vertical position on the floor or on the special pillow.
Yeah.
But it will be other condition will be child using wheelchair. He need using feetball for balance the first time, and after maybe 2 months using this training, he will be going to the next level here and using on the vertical position.
Yeah. So the next question it was. How many studies was published for cerebral palsy for each of the equipment and for
Rehaim.
I'm sorry. Rehaim. Also, how many studies were published exactly for cerebral palsy?
Yeah, we have agreement with one clinic in Russia. He is 40 city hospital, children hospital in St. Petersburg. We cooperation with using our device, and they have a clinical trial using translingual neurostimulation in the improved condition with cerebral palsy.
Yeah.
They have a very nice result. And this clinical trial show us perspective using this device together with other methodics training, for example, Lakamat, Armeo, Amadeo.
Because they had a control group. The control group was getting the standard typical physical training. So in order to prove that it is exactly the equipment realign which works, you compare the groups between training with Realigns and just training, the same training.
Yeah, correct.
Yeah.
In this clinic trial was 172 children. Control group was 60 person. Active group using translingual neurostimulation 112 children. Because hospital where were clinical trial, they is very good hospital, very nice organization, and a lot of very modern equipment, rehabilitation equipment. For example, Locomat, Amadeo, Armeo, stabilization.
So both groups were using Locomat, Amadeo, and and result it was how much person bigger in the group with the tongue stimulation?
It's what result? Yeah, it was improved condition patients with using translingual neurostimulation. more than approximately 20%, maybe more. It was using next scale. It was Ashford scale. I can check any else. And on this scale, we show that result will be more effective using translingual neurostimulation in the corporation standard rehabilitation program.
Of course.
And was, for example, their children were one time per year. And this clinical trial were more than 5 years. In this process, some patients were in this hospital any times.
Okay.
For example, approximately 12 persons were there more than 4 times.
Yeah.
And in the process of I maybe make additional
additional program.
no additional presentation,
Yeah.
and will be shown together with the scale and
Okay.
the dynamics.
Okay.
But there, what will be key result? It was usually when using standard rehabilitation program after 1 year, maybe the first time, 1 month or 2 months, and during 2 months, maybe something improve condition, but approximately after 2-3 months will be regress.
Yeah.
The same condition.
Yeah.
But using translingual neurostimulation, progress will be stabilization,
Oh, yeah.
not will be regress.
Yeah. There will be no regress.
Yeah, no regress. And we have some children. It will be screen of this history improved very any time in the
Each
1
time.
year.
Each
Yeah,
time.
each
Each
time.
time
Yeah.
they are doing
Yeah, and
the stimulation.
approximately in the 1 scale, it will be improved in during 4 years more than 64%.
Yeah.
Yeah, it will be
64%.
because it will be
Just
cumulative effect.
Yes, cumulative effect.
Cumulative effect, yeah. And what any else?
It was what GMFC generally in the study, all GMFC levels,
all
also
GMFC.
GMFC 4, 5, 3, 2, 1.
Yeah.
Even one you had in the study.
No. It will be common level. It will
Yeah.
be in 1, 2, 4, 3, 5 together.
Yeah.
And we have calibration here. Which level?
Yes, which level they studied.
What any else? In the usually effective rehabilitation program with children before it's standard in the published information, before more effective rehabilitation program before 8 years old.
Okay.
Before 8 years old, it will be you can using rehabilitation, but not effective before this age. Yeah, and our research show that effective using translingual neurostimulation and in the patients after 8 years old.
Okay.
Yeah, it was one of
one of the
points
the points of study.
Yeah.
Can you can you say also what others second machine we were using for Mark during spinal stimulation? Because and what was the difference between this machine and as well as other machines existing on the market? Because parents know about SpineX studies and as well this machine we were using and about Chattanooga. Because
we have spinal stimulation. What is it? There are a lot of articles, medical articles, because in the lumbar part of the spinal cord, autonomic working center. What is it? Stimulation in this part of the spinal cord, initiation working, or what it will be using in the experimental. For example, suspend patients on the special device equipment here.
Yeah.
It's a table, and before sacral part of
Yes,
of the
before his central.
because
Yes.
his their legs on the air, because in the suspend and
The suspended legs. Suspended
yeah.
legs. Yeah.
and stimulation lumbar cord spinal stimulation in the process after 1 minute patient starting initiation working. It's not will be going from his brain. It's only stimulation in the spinal cord.
You have such kind of videos to pass me?
Yeah, correct,
okay,
correct.
okay.
Yeah.
I can then show the videos of when you use this equipment to make movement.
Yeah.
Good.
It's mean what it's mean what help to us for rehabilitation. For example, we have patients with traumatic injury, spinal cord, cerebral palsy. What is cerebral palsy? It's
It is in the brain.
It's the brain, yeah. But using here, we can help our brain to recovery pattern of working. Yeah, and using the stimulation together with the translingual neurostimulation, it's help cumulative effect and help more soon and more effective to get result.
Yeah.
Yeah.
And it's helping. So, for example, there was one question from the parents. They are looking into spinal stimulation exactly for their son who was struck by the lightning. Exactly from the big
Correct.
And in such case also it can work because it's a motor nerves was damaged, and even if the motor nerves damaged, it's possible to use spinal stimulation.
Correct. Because in this email they introduce that not will be broken nerve trunks.
Yeah.
It's not damaged. Yeah.
If his spine is not damaged, even if the nerve was damaged, but the spine was not damaged.
I don't know specific situation in this case, but my experience, you can using here spinal stimulation together with traumatic translingual stimulation. We have one case.
By the way, they asked me a question why once we used for Mark also Realin at the translingual stimulation at the same time that the spinal stimulation.
Yeah.
So why?
Why? Because we can help to get impulse from the brain to the leg through spinal cord. We can initiation going impulse to the leg.
Yeah. And at the same time, if they make it tell you,
we can create new nerves connection, because in the case of the disease, what's happened? It's discoordination and loose connection in the brain between neurons. We need to recover these connections in the brain, and in the first time we can to help going the impulse in the cord, and the next time we can help to create new communications. I think it will be good effective methodics. Yeah.
So it's maybe give even better results with both together.
Yeah.
But not too much for organisms, so not every time.
Yeah.
During stimulation.
Yeah.
See. Other question, it was about what potential side effects from the translingual stimulation, and as well from the spinal stimulation. Potential side effects.
Spinal stimulation.
Any potential possible side effects.
Mm-hmm.
Some parents ask about epilepsy.
Usually we using translingual neurostimulation. We not see a side effect. For example, maybe yes, it's the difficult case of the epilepsy. Maybe many times epilepsy in the day. Yes, maybe it will be difficult.
Be more difficult for the
Yeah.
child who has a big epilepsy and it's not controlled.
Yeah. If you be patients on the medication and there are seizures in their safety, we can use it. It's no problem. For example, we have a small clinical trial. It was approximately 30 patients with epilepsy, and we tried to see what will be
The results.
Result, yeah, and will be in the during half year. There we in these 4 points of check AG. There was first training 2 weeks before and after. It will be check AG activity each patient.
Yes, of each patient about his epilepsy. You
Yeah,
did
yeah. And checked in the next training after half year, before and after, and we comprehensive.
You compare the results.
Compare a result, and we not watch difference. It will not will be regress.
There is no regress, but there is no progress.
No progress, no regress. Yeah. It's mean not side effect. It's not control surgeries. It's not using.
It's not helping
not
for
helping.
surgeries, for seizures, for epilepsy, but it's not giving any side effect that make it worse. It's not worsening.
Yeah, but one case in this moment in the treatment epilepsy using some methodics, non-invasive methodics. Usually medication, but trying to using non-invasive methodic stimulation. It was it's stimulation trilingual nerve and stimulation vagus nerve stimulation. Using a special device put here on the left vagus, using these methodics using in the untreatable epilepsy. Because they stimulation vagus nerve. Next methodic, it's stimulation on the upper part of the trilingual nerve on the front.
And you have this device also in clinic?
No. It's in the vault.
In the vault.
Yes. It's mean using two nerve. It's vagus nerve and using trilingual nerve. Translingual nerve stimulation using this nerve is true.
Also. It's influence also the same nerves. Translingual.
And maybe there will be something trial research.
But for a moment we don't have trial research for epilepsy.
It's maybe in the future. It will be. We will check what will be
happening. I see. The next question, it was about the spinal stimulation and about waves. If you compare spinal stimulation, the waves of Chattanooga and the equipment we were using and SpineX. You remember we discussed. I asked you to show me the waves. If we have to show it, maybe for the people, we need to show maybe your computer, because you showed me exactly the graphics.
What interesting, Chattanooga using its neurostimulator. Neurostimulator for muscle. And they're using special waves of signal. It's
you can show me, because I will bring this camera. Show me exactly the signal. Then the parents can see what you showed me when I asked you this question.
Just
also,
moment.
Because when you was using it was one of the questions I had.
Very interesting. Just a moment.
moment.
Так, это... Так, это параметр. Нет, сейчас. Вот он.
Yeah.
Так, вот этот сейчас.
Emmett,
Да, вот это будет нормально, да.
И ты можешь говорить сразу.
Да.
This is the waves. You show me these waves when I ask you a question.
This is waves Chattanooga.
Yes.
It's maybe
On the up of the it's Chattanooga waves.
Chattanooga, yeah. What it means? It's not a repolarization.
There is no repolarization. I don't know what it means, but it means something.
Yeah. What it means? It's only activation.
Yeah.
It's not will be anti-stimulation in the low, but in the it's okay for muscle, but for spinal cord they're going nerve trunks.
Yeah.
Very big trunks.
Yeah.
If you be using this type of stimulation after 2 minutes or 5 minutes will be depolarization. What it means?
What it means for the child?
For child, it will be maybe сейчас момент так. Или ожог, сейчас правильно.
Но ожога не будет.
Не может быть.
Нервничать будет.
Сюда идентификация, это не устраивает. Да, тогда начнем, да. Bilateral exclude polarization of the membranes of nerve cells, which can lead to a local burn or
Unpleasant
sensations in the form of the painful effect.
Painful effect from Chattanooga, while from the spinal stimulation which we done with the Neurostim 3, we did Neurostim 3 with you, and from the SpineX we don't have such kind of, because they have another waves, and it's exactly these waves which the Gerasimenko he has a patent.
It's patent. It's more.
It's patented.
It's more safety signal pattern stimulation for spinal cord. This part of stimul will be correct and not will be have effect.
But still, we have a case of study which Chattanooga published.
They using only
very small period of time, 5 minutes it was.
On the
and very small
directly on the spinal
on the
cord.
Spinal cord, yeah.
No more, maybe only 5 minutes it's possible, but more no.
More it's too much. Maybe
it's
too much.
Yeah.
It can some children's, but some children react very well. So that's why it was my question, because I saw, for example, Mark, he reacted to Chattanooga, and it was my question. It was one of my questions why I came here. So that's why, if you can send me this this picture later, then I can put. So we will restart again our discussion in our room about, as I said, I will do just interview at the last day. And so next question about because I have a lot. So how much it cost?
Standard price $5,000.
Yeah.
And additional will
You
be
mean Rehaline?
Rehaline,
this one.
Yeah. Including unit, mouthpiece, limit 1 year, and not need to reset device.
Okay. What else about clinic? Something about clinic. So if parents in reality, so you're preparing for the international clients, I can come because I speak Russian. Мы по-русски говорим с Женей, поэтому здесь намного проще. Because I speak Russian, so it was much more easier. But at any case, in Uzbekistan, people can come without visa.
No visa.
No visa. It's very safe.
Very safe.
I visited French embassy exactly for this case, and I will give you a link about safety. Honestly, the representative of embassy, he said me during 3 years, no one case of French citizen who was even took money on the street. So even without any other big cases, but even they very calm country.
Yeah.
But of course people don't speak English, not much.
Yeah.
And
Yeah.
no French also. That's a problem, and that's why you're
Yeah.
going to make all organization
Yeah.
needed for
Yeah,
the
yeah.
people.
We go into organization program for foreign patients. It's what it's mean. It's meeting in the airport, because when we go out to the street after airport, it will be shock. Where is my taxi? It will be not you find very quickly. It needs support in the airport. It's not difficult, but it's easy. But we'll be in the process. Yeah, maybe some patient needs translator. It's maybe
Maybe even for everyday life, because even
yeah.
to go to the shop or to go to the restaurant, nobody speak English.
Yeah.
Honestly.
Organization, we tried organization two type of accommodation. One accommodation in the clinic, because we have rooms,
Talk about
spatial rooms. The same in the hotel. It will be including a room and bathroom and including питание.
the all meals.
Oh, meals, yeah,
Meals
meals.
also like a hotel, but it will be like a medical hotel, for example. That's why I choose real hotel.
Yeah.
I need to be free.
Yeah.
But it depends also from the level. For example, you have to think that the hotel is less equipped for the children in a wheelchair. In my case, I have a child who is walking, so I can make take a hotel, and for example, you will offer the people some hotels, 2-3 hotels to choose. We discuss price for the parents
Yeah.
if they want to stay in hotel. Yeah.
Yes.
Next question about the clinic also, as we did also some training in hotel. Some parents saw already, and they asked me why you did in hotel. I said because for me it was more convenient. Honestly, they came to me to hotel, and not forget that now here and in all ex-Soviet country we have a new year. So new year, that means vacation also. And for me it was much more easier to come to hotel, and we visited clinic. I will put you a video, and also all the rooms. I will put you just a video rolic about all the clinic, what they have in clinic with the descriptions. But we preferred to make a lot of training in our hotel, and it was very convenient because we discussed with the hotel possibility to use their sports equipment and accepted sports equipment, because I wanted to use the treadmill for Mark. Next question about the clinic. I will send you a separate videos, because we will not put it here. But the last question about the replacement parts. Replacement parts, they don't need to come, for example, for Uzbekistan. They can just order. For example, the mouthpiece.
Mouthpiece,
yeah. And also the long-term use of the pediatric patient. They need to continue to use this device regularly on everyday basis, or they can stop sometimes. Until what age they need to use? Is it for the life or what? Or what you think?
Our experience show that they need regular active training. It may be 2 or 3 weeks usually. It may be 1 per year or 2 times per year. During between this active training, you can using some exercise at home, because you not have time every time going to the active training.
Normally, for example, active training during 2 weeks you do in clinic. How much hours per day child walking with the different equipment?
Usually 2 times. Two times in the morning and after lunch. During approximately 2 or 3 hours.
2 or 3 hours per day. Per half a day.
Half a day.
So 6 hours included in the price of clinic.
4 or
and
6
how
hours.
much it will be 2 weeks clinic stay with training.
With training,
Without living in because in living you will have price separately just only for somebody who wants to stay in clinic, or somebody who wants to stay in hotel, he will pay hotel separately. But exactly training in clinic for 2 weeks, how much is it?
It's maybe it's I cannot to say very clean the situation. I can show only from to us. It's what it's mean.
What it will depends from the therapy they will took.
Yeah,
It's
What-
individualized.
Yes, certainly.
Yeah, so you have to make it like invoice.
Individual, yeah.
Individually you propose for the child, for his condition, you will propose, okay, you can take just the full set.
Just from $2,500 2 weeks up to maybe 5,000.
5,000
Yes,
maximum if
yeah.
it's a lot of
Yeah,
therapy for
yeah.
the child.
Yeah,
So from 2.5 till 5, it depends for how much therapy will be per day and
Yeah.
how much hours per day what parents will choose for
Yeah.
them. And also they have a choice. Some parents, for example, like me, they prefer to have only half a day and a half a day to make it tourism. It
yeah.
depends.
Yeah, yeah.
It depends. Yeah. Okay.
Yeah.
Okay. That's a good question. It was in fact the last question about the pediatric. So if you have something else other to say, do it.
Yeah.
That's all.
Yes, so.
So if you have any other questions, please parents ask me. I will ask then Danilov or Evgeny to make a Zooms with you. If you want to make Zooms with them by yourself, you can ask me and we can organize multiple Zoom. That means it will be them and also at the same time, for example, 3-4 parents, because we will not do Zooms for 20 parents, okay? Just 3-4 parents maximum.
Yeah.
Okay, and we can answer all if you have